Hi everybody, this is Dr. Rue and welcome to my channel. Today we're going to talk about what is cognitive behavioral therapy or CBT. So cognitive behavioral therapy originated around 1960s and the father of cognitive behavioral therapy is Aaron Beck. But most importantly, the premise behind cognitive behavioral therapy is that thoughts, feelings, and behaviors are all interconnected. So when one experiences a change in thought or a change in behavior, the feelings are also going to be impacted as a result of that. Now, at the core of cognitive behavioral therapy, there is the understanding that the way that we form thoughts, the way that we form our beliefs about the world, start from early childhood. So when somebody experiences trauma in their life or some messages early on in life, that's how they later on develop and start seeing or viewing the world. Some of those thoughts can be extremely hurtful or harmful for somebody, and later on there is an interference in their everyday experience that result in inability for them to function effectively. This can lead to depression, anxiety, and a lot of other different mental health conditions. What cognitive behavioral therapy is really designed to do is to understand some of those core beliefs that manifested earlier in life and help people understand where this situation is coming from so that they can resolve those issues and understand their thought pattern better. In addition to that, there is an opportunity to explore different behavioral interventions to help somebody overcome some of those barriers and challenge some of those thoughts. So in other words, if somebody grew up in an environment where other people disappointed them or they realized that other people should not be trusted, through CBT, they actually learn to form and challenge some of those earlier beliefs. They're also invited to participate in different behavioral activations because the one thing that really help facilitate change is by actually taking action and engaging in certain behaviors. This form of therapy has been extremely beneficial for a lot of people to challenge some of those beliefs and really overcome significant barriers. It can help with insomnia, it can help with depression, anxiety. It is considered an evidence-based therapy, which means that there is a way to track and show that over time, people who engage in that kind of behavior, cognitive behavioral therapy, they benefited from it in a way that was very helpful and facilitated significant change in their lives. Cognitive behavioral therapy is not only talk, it's a lot of action, and through therapy, the client is encouraged and invited to do different experiments and engage in different homework so that they can explore for themselves if that kind of different interventions are helpful for them or not. So if you are working with a therapist and expected to participate in cognitive behavioral therapy, some of the work is going to fall on you because that is the only way for you to really test and make sure that this helps and applies to your situation. So this was a very short introduction to what cognitive behavioral therapy is, and I hope this was helpful. Let me know down below if you have additional questions about cognitive behavioral therapy or other forms of therapy.